Hi, this is Dr. Gary Breslow. We're going to talk today about breast augmentation. This is Madison Kepler. She's our physician assistant. She's going to lead the Q&A session.
All right, Dr. Breslow, what are the most common breast augmentation complications?
Whenever a breast augmentation is performed, it is surgery, so there are risks of the procedure. There's always a risk that you can be too large and you could be too small, which is why trying on sizes beforehand and having an in-depth discussion with the surgeon as to which size you're interested in having done is important. There's a risk of implant malposition. The implants could be either too high, or they could end up something called bottoming out, or they could also end up too wide depending upon how the pocket was created. You can have changes in sensation to the breast itself and or to the nipple. When that happens, it's usually transient. It usually comes back, but sometimes it does not. There's risks of wound complications at the incision site. You could have a risk of an exposure. You can have infections, which is possible. You can also have something called the capsular contracture. Every implant that's placed gets a capsule a scar capsule that gets formed around it. The most implant capsules are what we call grade 1. You don't even know it's there. Grade 2 capsules tend to be firm. Grade 3 is firm and distorted, and grade 4 is firm, distorted, and painful. And grade 3 or grade 4 is what's considered a capsular contracture, and sometimes we have to go back in and take out the implant and take out the capsule. And then replace the implant. It's not common when you go into the muscle. It's actually very uncommon. When you go over the muscle, it tends to be much, much more common, which is why we almost exclusively go under the muscle when we perform the procedure.
Which breast implants are the safest?
So there's a few different kinds of implants. There's saline-filled implants and silicone-filled implants. Saline is just salt water. It makes up over 70% of your body. So if the saline implants rupture, it just dissolves, and you'll actually see it dissolve. It gets absorbed into the body. There's also silicone implants, which most women nowadays have silicone implants. They tend to look and feel more natural. And the silicone we use today is, I would think about it more as jello rather than jelly. If there's a rupture, it doesn't leak out into the body. That being said, you're not going to know that it ruptures if it ruptures. So the most effective way of finding out is to get an MRI. But they are the most tested device in the history of the FDA, and they've been shown to be entirely safe. But again, there's been risks associated with something called ALCL cancer, which is with both saline and silicone, and that's really been associated with textured implants. And when you take the implants out, it goes away. So it's been that's the biggest risk of implants.
Okay. Now, is breast implant rupture common?
The rupture rate is less than 1% per year. So in 10 years, there's a better than 90% chance the implant will be intact. Having said that, we basically encourage patients not to put in the implants and forget about them. After 10 to 15 years, they should consider to think about replacing them. There's an FDA recommendation that if you get silicone implants, that you get an MRI after the first 3 years and every 2 years thereafter to evaluate for a rupture. But that's just a recommendation. It's not a requirement.
Can breast implants make you sick?
There's a phenomenon out there called breast implant illness, which is a constellation of symptoms which include fatigue, discomfort. It's almost like a chronic fatigue constellation of symptoms. The scientific data does not show a correlation yet, or a causation between implants and breast implant illnesses. So it's still up in the air as to whether or not that's the case. Again, it's the most tested device in the history of the FDA, but there are reports of patients who've had, whether it be saline or silicone, who've had implants, and they had symptoms of this that could not be accounted for. And once the implants were removed, the symptoms went away. But these are very uncommon, but they have been reported.
Can implants cause chest pain?
In terms of anginal chest pain, like cardiac pain, no. You can get chest pain when the implants get placed under the muscle. You're going to be sore from that until you recover. And then if you overexert yourself, usually in the first year, there's patients can come back reporting that they feel sore in their chest because basically the muscle's has been strained as a result of it. It's kind of like a pulled muscle. And at any point after the implants are placed, if you overexert your pectoralis muscles, you can develop pain in the chest from that.
So with exercises, are you able to do any chest exercises after surgery?
We do not allow our patients to do any chest exercises for the first 3 months. And then after that, we tell them they should ease back into it, and then they could resume their normal activity.
Can breast implants freeze?
Breast implants do not freeze. They can get cold if you're in extremely cold temperatures, but the breast implants will not freeze.
And can they pop? I guess some people ask with the differences and changes in elevation if you're on an airplane or something like that.
The breast implants will not pop or rupture just as a result of that traumas, car accidents. If there are severe traumas to the breast, can cause a rupture. But these are very structurally sound devices. They're rigorously tested, and the shells, over the past 20 to 30 years have evolved to become very, very strong and resistant to rupture.
Okay. And last, can breast implants cause lupus?
There has been, as I said, it's the most tested device. There has been no causal relationship between lupus or any other known autoimmune diseases with breast implants, between breast implants and the autoimmune diseases. So it does not cause breast cancer. It does not cause autoimmune diseases. There is a study that's been done that's showing that women who have breast implants are more likely to detect breast cancer. The reason being either that they're more in touch with their breast, that they've already had an implant done, or it may make it more palpable and more noticeable. But no, it does not cause breast cancer, except with the exception of ALCL. There's been a relationship, but ALCL is not breast cancer. It's a lymphatic cancer that's associated with textured implants, and it's extremely rare, but there is an association there.
Okay. Well, that's it. Thank you so much.
Thank you.